Yeah, let me just back up first. On the Lancet study and the New England Journal of Medicine study, both were retracted. And I really want to emphasize that's a very rare thing for a world-famous journal to do. I mean, to be published in the Lancet and to be published in the New England Journal of Medicine is no easy feat. It's the world-class editors and journal, and people all over the world listen to these journals. There's a handful of journals in that category. Those are probably the number 1 and 2. So to have them do a retraction was a major story, which is why you heard about it in the headlines. The reason their study was retracted is the data that went into those studies could not be independently verified. You can draw what conclusions from that as you will. Was the data even gathered? Was the data faulty? Was it fabricated? We don't know because we asked the company that provided the data, a company called Surgisphere, which has been quite secretive, to reveal their data, and they have absolutely refused. Because they wouldn't reveal their data, those studies had to be retracted by the journals. That's the problem with those. In addition, a story that hasn't been discussed really in the media is a third world premier class medical journal, Journal of the American Medical Association, known as JAMA, also is severely flawed. And there are a number of flaws with this. The first major flaw in the JAMA study is what I would call pseudo-randomization. To do an effective medical study, you have to randomize the patients into different groups that have this character and that character. And the point being that the groups should be generally similar so that you know if the drug actually made the difference. If you give the drug here but not here, it doesn't really help if the groups themselves are pretty different, right? So you kind of make them even in terms of age or risk factors, heart disease, etc. When you look at the study itself, as it's printed right now in JAMA, your listeners, I encourage you, viewers, to go and look this up yourself. On page 7 of the study, you can look and see that the groups are not equal. The higher dose group is 7 years older. They have almost 18% heart disease. Those are just 2 of the differences. The other group is 7 years younger and has 0% heart disease. And there's a number of these flaws that are different in the 2 groups. By itself, that's cherry picking of patients that would make any data that comes from such a study suspect. So I want to be clear that the JAMA study used not exactly hydroxychloroquine. They used a drug called chloroquine, which is really a precursor to hydroxychloroquine. Sometimes we use those names interchangeably, but in America we only use hydroxychloroquine. The JAMA study was in Brazil. They used chloroquine. The lethal dose of chloroquine has been well established for more than 30 years. In 1988, New England Journal of Medicine, again one of the world premier journals, established and everyone accepts that the lethal dose of chloroquine is 5 grams. Well, the JAMA study had 2 groups. In the high dose chloroquine group, they gave them 1.2 grams a day, which means by the 4th day, they had almost 5 grams. Now, most of us think of a drug as going through your system kind of quickly, and you're like, well, it's been 4 or 5 days. That's not the case with chloroquine and hydroxychloroquine. Hydroxychloroquine and chloroquine sit in your body for a very long time, at least a month, perhaps 2 months, somewhere between 30 and 60 days is its half-life. So to give somebody 4.8 grams in 4 days is a very large dose. People would often possibly call that a lethal dose. The study went on for 10 days, which meant that the people in that group got 12 grams. Again, New England Journal of Medicine, 1988, established 5 grams as a lethal dose. If you don't think it's lethal, you would at least say it's very toxic, and patients would be expected to have a lot of neurologic symptoms or cardiovascular symptoms. You would certainly expect them to be vomiting. Mind you, these are elderly, critically ill patients that are intubated or severe respiratory distress. You don't want these people to be vomiting. That's hugely risk factor. It's not just my speculation or the science data that says this is a very high toxic dose. So many patients died in the high dose group that they halted that study early. They quit the high dose group because so many patients died. That's extremely dramatic for a scientific study. It's very unusual for a study to have given such a large dose of a medication because all scientific studies that involve human subjects have to be overseen by an ethics board. The scientists that did this study presented the paper to JAMA saying that they went through an ethics board. However, that's in doubt. The Brazilian Ministry of Justice is actually investigating. There's actually no proof that there actually was an ethics board. I can't speak to if they absolutely had it or not, but what I can say is there's no proof that they had it. They normally have a certain committee number that's stamped on the paperwork, and they don't have that. We have written to them and tried to get it, and there has been no response on that. So the Ministry of Justice is actually investigating the deaths of all those patients who died in the high-dose chloroquine group.